half a day or more, we've been discussing about the primary hazards. So for this last session, and I hope you're still up to it, we will be talking about secondary hazards. Are we also trying to anticipate and respond to these? And how are the mechanisms really responding to all of these secondary hazards? I would like you to imagine that while you are responding to a typhoon, and all of a sudden, while doing all of this, you are faced with an aftermath of a surge in dengue cases, or probably an environmental hazard like the oil spill that happened recently. Are we anticipating all of this, or are we just anticipating the impacts of a primary hazard? And so we're looking at, for this session, how are we responding when these secondary hazards escalate the crisis, compound the risks, and create new challenges for the communities? In this session, we would like to unpack the lessons learned from managing secondary hazards, from their early identification to effective interventions. We have two speakers to cover all of this. And probably we'll look at the risk into anticipatory frameworks. How are we doing this? And how do we ensure holistic, timely, and sustainable responses, not just to the primary hazard, but also to the secondary hazards? Or are we looking at, is the secondary hazard as critical as the primary hazard? So we have two speakers to look at how to translate our anticipatory action learnings to secondary hazards. We have two ladies. We have Verinda Dar from Relief International. She is the country director. And another country director, Raisa De Hito from the CARE Philippines. Verinda Dar from Relief International has 25 years of experience in designing, managing, and evaluating a broad spectrum of development and humanitarian programs. Verinda has been all over. She has worked across countries in Europe, Asia, Middle East, and Africa. Verinda has a doctorate in peace studies and has been working in so many capacities: country director, program director, advisor, and consultant to many research institutions for international NGOs, national government, UN, World Bank, name it, I think she has done it. The other speaker that we have is Ms. Raisa De Hito. She is a champion of anticipatory and locally led humanitarian action, driving innovative solutions that empower communities to lead their own development. As a country director of CARE Philippines, Raisa leads efforts to transform humanitarian response by prioritizing early action and inclusive community-driven programs. Her career spans over, this is a revelation of age, over 15 years of leadership across Asia and Africa. Okay, so is Verinda and Raisa competing in terms of their humanitarian experience? So Raisa has been in Africa, in Asia, including a decade of humanity inclusion managing programs in Nepal, India, Sri Lanka, Bangladesh, South Sudan, and beyond. So these are really traveling ladies, okay? But traveling because they need to respond to a lot of emergencies. So again, for the secondary hazards, let us welcome Verinda, our first resource. Verinda, please.
So everyone's awake?
I hope.
Oh, I hope so. My voice is loud enough to wake you up in case you decide to go to sleep or go and do your work and check emails and phones. But actually, I've also been doing that off and on, so I can't complain too much. So I'll take you through what has been a recent project awarded by Start Fund. Actually, in a year which has been with back-to-back typhoons. And my experience in the Philippines is unique. Despite my having traveled across continents, this kind of exposure to natural hazards, and especially typhoons and tropical storms, is unique in the Philippines. Really exposing communities again and again to the same risk. So in some ways, we find that there is a resilience in the negative way, a resilience of the community, but at the same time, you find that it's so difficult to recover back from one typhoon after the other, that any kind of support that comes from any corner is really needed. And at the same time, of course, we have the advantage that there is local ownership. The government, in many countries that I've worked in, there is either no government or NGOs are running the whole show, or we are coming from situations of disaster and conflict. But we are very fortunate that there is a government, there's devolution of power towards the local level. It's just that we need to, as civil society organizations, come in and support on either way, the community and the government. So if someone helps me technically with how to start this. All right. Okay. So we had, in this year actually, like as we are talking, we are actually in the midst of a Start Fund project that has been awarded to a consortium for a response, which means a 45-day response. While this was another project that was awarded in August, I think, which was anticipatory action. So two different kinds of modalities of funding in between a typhoon season, which is in a cycle of a year. So just to make you understand that there can be different ways of looking at and different situations that present themselves when we have Start Fund coming in to chip in and contribute to funding within a country. So a lot of the team is in the field. I'm not the best person to be the speaker here, but I do have in the hot seat with me, and I'll bring them in, those of the consortium. One who has, maybe I will excuse her because she's just gone through a spate of questions, which is Melanie. But I have others from PhilRads, from Relief International, and maybe others from Humanity Inclusion. Is there anyone from World Vision? No? All right, let's see if I can handle the hot seat or share the joy of the hot seat with everyone. Let's go to a background of this. So we have, I think all of us know this, but just in case there's one of us who's forgotten and the memories are short, say, July 24th, we have Typhoon Karina that enters the Philippines area of responsibility. The hardest hit areas include, and we know this, cities, the neighborhoods, the barangays. Metro Manila experienced urban flooding, and this was when I was on leave, so I was actually virtually connected, even if I was not here. There were road closures, significant disruptions, and some of the barangays were majorly impacted. The Start Network members decided to raise an alert. It was a huge impact, but within this huge impact, there were areas that were particularly impacted, and we all thought, instead of going in for a response, let's go in for an anticipatory action because we are expecting more typhoons. There's projection of more typhoons, and as the season begins, we could actually go into an anticipatory action. And that is what we decided, and we focused it majorly on health, which was emerging to be one of the gaps and needs on the ground. And as you would see, within 24 hours, the alert gets activated. Within 24 hours, there's a project selection committee that sits in Start Fund that selects the project, and within 24 hours, it's awarded. I mean, it's an amazingly rapid mechanism that brings support to the communities within the first 7 days of raising an alert. So, and then usually we form consortia as we go along, and we have to have an operational presence to hit the ground running, otherwise it becomes difficult, as you would have also understood from Melanie's presentation. So why an anticipatory action and why not a response, right? So essentially it was because there was a lot of debris collection that required cleaning before, and in order to clean and prepare and build the awareness of the community as to what could happen again and how do we manage that if it happens again. We had regular coordination with the Department of Health because we know historical data shows that. That post-typhoon, there's always a risk of incidents of waterborne illnesses. So we were since Relief International has a major health program in partnership with UNICEF across the country, we were working already with them. So it was a regular kind of monitoring that was happening that actually became more intense once the typhoon hit. And then ensuring this continuation of health programs. So if you go into an anticipatory action, we can't go into a standalone response. We're looking at something, at some action and intervention that is then taken on, led by, and owned by the local authorities or the health department or the local public agencies. We knew there was a forecast of a multiple typhoon season, so that also helped us to understand that a response might not be enough. We need anticipatory action. I don't know how many, but there are very few anticipatory actions awarded because by Start Fund, not because there's no willingness, there's massive willingness there, but it's that there's a very slight, I would say, a margin between whether it's a response or anticipatory action. Sometimes it's not understood. And I think Start Fund is doing quite a lot to build awareness of and understanding and encouraging proposals that come through and alerts that come through that are more for anticipatory action rather than always thinking of a response. Then, of course, a health-focused anticipatory action in disaster risk reduction and management actually mitigates the immediate risk of a potential disease outbreak. And we were seeing that there were lots of dengue cases that were increasing. And that was one of the reasons also that we went into an anticipatory action, focusing more on health and hygiene. And then strengthening community and municipal level disease surveillance, which was something new and innovative, I would say, to bring in the whole idea of preventive mitigation of a disease outbreak through surveillance, which proved to be a difficult activity because it's a longer term activity, but anyway we wanted to bring that in as thinking on how to utilize disease surveillance to prevent or at least reduce the incidence of waterborne illnesses and outbreaks. All right, maybe I share my joy with Nico Rastrullo. He's our meal coordinator, monitoring, evaluation, accountability, and learning coordinator. And he will present you the dashboard and the results of a post-distribution monitoring that we had that somehow gives us an idea of what these activities had an impact on, but also what utilization was there after the action was over, completed. Yeah.
Okay, thank you, Vrinda. So these are the activities that we conducted for IADOR. So first, we conducted risk communication and community engagement. So we conducted two kinds of RCCE activities. First is a one-way, the first modality is the one-way communication where we conducted radio and TV guestings to reach more than 267,000 individuals in terms of messaging. The second modality is the face-to-face modality or the two-way process communication where of course, we value feedback and face-to-face engagement with our stakeholders. So using that modality, we were able to reach more than 55,000 individuals in our target areas. Next activity is the distribution of hygiene and water kits. We were able to distribute 2,644 hygiene and water kits, benefiting 12,600 individuals. Included as well is yung pong community cleaning kits, 65 cleaning kits distributed to 16 barangays, target barangays. And then the cash for work to ensure that vector and waterborne diseases ay malalasan. So 747 households po yung na-reach ng consortium to ensure na nalilinis yung community spaces after the typhoon. since we are also working with the epidemiology and surveillance units of the barangays and the cities that we are working that we work with during the IADOR support, we gave them 5,300 dengue kits as well, and 40 assistive devices are also distributed to the beneficiaries. And lastly, to ensure, as mentioned by Brinda earlier, to ensure that the barangay health emergency response team ay capacitated po, we also trained them on disease surveillance. So here are some of the PDM insights from our beneficiaries. So in terms of selection, 99.2% of our participants or beneficiaries are satisfied or very satisfied of the selection process. So what happened, the barangay, based on the vulnerability criteria, the barangay gave the consortium or endorsed to the consortium a list of beneficiaries. In terms of validating, the consortium conducted a house-to-house validation activity where they conducted interview, again following the vulnerability criteria. Next, including naman po is the top 5 most used items in the hygiene kits that the consortium distributed. So the first or most used po ay yung bath soap, laundry soap, toothpaste, shampoo, and alcohol. Aside from that, we all included in the hygiene kit is our underwear for women, toothbrush for adults and kids, towels, buckets, blankets, tabo, solar lamp, and sanitary napkins. Next is in terms naman po of satisfaction. Thank you. In terms of satisfaction of the quantity of the hygiene kits that we distributed, 78% of the respondents said that they think or they feel like the distributed hygiene kits will last them more than 1 month. And then 18% said that it's just enough for 1 month, and 4% said that it's less than enough for 1 month. In terms of cash for work, the profile, 77% of our participants are female and 23% ay male naman po. In terms of age, 76% ay 18 to 50 years old, and then almost 25% of our participants are more than 50 years old. For the satisfaction of our beneficiary in terms of the 3-day cash for work program, 99% of the beneficiaries said that they are satisfied or very satisfied of the cash for work program to ensure that their community is clean and safe from vector and waterborne diseases. So that's the result of the PDM and also the activities that we conducted.
Then there was also, within the PDM, many questions around how you utilized the cash for work. Then I'm sure you have a lot of questions around some of these activities that we can leave for the question answer session. And we'll go forward. We'll look at some of the challenges, really few challenges. Many of the other challenges that were addressed emerged as best practices. Those that we learned while addressing came out as lessons learned. We've kind of clubbed it together later on under what we call recommendations, but they're largely a combination of what we learned during project implementation and what came out to be as best practices. Of course, some of the challenges were that there was unfavorable weather conditions, there was heavy rain when we started our work in the barangay, so we had to stop it for a week and a half nearly, week to week and a half. Some of the capacity building activities, since since the health department and the barangay officials were really, really busy. It was besides it being post-typhoon and evacuation, there was garbage cleaning and debris cleaning in many other parts of the neighborhoods and barangays. So we had difficulty in bringing the health workers and finding the right time to bring in the capacity building activities. That was a bit challenging. Also, the number of beneficiaries in cash work couldn't be a large number. We had to restrict it. We would have liked to have a larger number, but funds had to be distributed across different activities with the right balance. And then the platform for disease surveillance actually varies a bit from municipality to the other in terms of their capacity and their utilization. So getting that going and building capacity of the utilizers was a bit challenging. Of course, besides this, there were other challenges, but let's go to some of the learnings, recommendations, insights. So we realized that health bulletin dashboards and mapping for clustering of disease actually and other information systems was very critical. The capacity building for what they call the barangay health emergency response teams and other health staff to understand how the disease surveillance platform works also was very important, and not all of them knew about it. The data management, depending on which local government unit had better data management and data quality, it impacted on how we selected beneficiaries, how long we took to select the beneficiaries, as well as how that data was managed during the project implementation. It also provided a lot of opportunity for advocacy for local policies on disease surveillance and for response plans to be regularly updated. So some of the local government units had this running, but the others didn't. So it became a sort of, I would say, best practices in the sense that all these, the more they are, the more attention there is of the LGUs on it and the health department, the more effective and anticipatory action would be, the more owned and led locally it will be. Going into WASH, we also realized that if there was regular testing and monitoring of the water quality, this would have made a big difference in terms of potential disease outbreaks and waterborne illnesses, as, of course, the awareness of the population. The provision of hygiene kits was important. It was used for a whole month, but then it's kind of often used as a response mechanism. We used it more as an anticipatory action because we were looking at the possibility of another tropical storm, which means that they would need to be ready with stocks in hand. And essentially that hygiene kit and safe water kits, which were essentially purification tablets and jerry cans, etc., provided the stock that they could have, because some of it was lost and some of it could even get lost in the future. What we call RCC activities, or risk communication, community engagement activities, helped in refreshing memories. It's not that people don't know that they must wash hands, that they must keep a surveillance on waterborne illnesses in the family, move to the healthcare services much earlier, because 95%, I think, came out in the PDM, actually had a family member that had contracted a waterborne illness. Then training the barangay health workers in WASH promotion, although many of them know, some of them have joined new, they may not have had the same level of capacity building, so it's always good to bring in a kind of a refresher on it. I don't know how much time I have, but I'll run through. Going into disaster risk reduction, of course, the community cleaning activities were quite, how would I say, welcome in the community. Ooh! It's a wrap up, please. I'm happy to wrap up. All right. I think you can all read, and we can move. Maybe that's faster. Of course, we know that when we collaborate with the community, we collaborate with the local government units, and we already have established collaborations, it becomes much faster. Everything becomes smoother, everything becomes faster, beneficiary selection, implementation of the project, local ownership, everything eases out if you have already interaction and working relationships with the local government units and public agencies. You got a crux of what I was saying. Hopefully, I didn't go too fast. And you can ask me questions, so then they will not ask us to wrap up when you have questions. So you can go ahead. Thank you.
The secondary hazard that will be shared to us, experienced by CARE Philippines, will be RISA. This will really talk about environmental hazard, particularly the oil spill that happened in Bulacan and Bataan.
Good afternoon, everyone. Sana ay gising pa kayong lahat. Maayong panihapon. Maayong hapon di ay. So, I am going to talk about the response to oil spill. This is really interesting because we didn't know if we were going to raise an alert anyway for the oil spill, because at that time there was also Typhoon Karina or Super Typhoon Karina. So busy ang mga tao. Everybody was so busy. I have to shift to English. Everybody was really busy trying to do needs and damage assessment for Typhoon Karina. Everybody was trying to mobilize resources for Typhoon Karina, and everybody was just like starting the response for Typhoon Karina. So the oil spill in Bataan or Manila Bay was actually under the radar, because even if you saw it in the news, there was not much parang attention actually given to it, right? And then much of the information that we saw in the news was just about the environmental damage or the environmental impact of the oil spill. There was not much talk about, what is the humanitarian impact, for instance. Yes, ay, salamat. Kayo na lang. Yes, there was not much talk about the humanitarian impact, but in fact, during that time, when the MT Terra Nova capsized in the Manila Bay, 1.4 million liters of oil was released into Manila Bay. And then you all knew that after a few days, there were also two succeeding capsizing of boats from MV Mirola 1 and MTKR Jason Bradley. Hindi ko alam kung anong ibig sabihin yan. No? But it actually compounded the impact of the oil spill, because while the Philippine Coast Guard and the LGUs were trying to contain the spill, there were two succeeding incidents as well. And then because of the southwest monsoon, medyo mahirap din. There were a lot of rough waves, so it was kind of difficult. And then the trajectory of the spill, although it was actually shown on satellite, but we didn't know where the spill was going to go. Was it going to go to the Manila Bay area, Bataan, Bulacan, Cavite, Laguna, etc. So, of course, Typhoon Karina worsened the crisis. First, because there were no more resources, or there was less resources and attention that was given to the oil spill. Next, please. So over 160,000 people in Region 3 and Calabarzon were affected. And fishing bans, so there were, initially BFAR didn't issue a fishing ban, and then they did, and then it was kind of confusing. But we all know that it disrupted livelihoods and food supply, because even if the fishing communities or the fisher folks were able to fish, many of the communities also did not buy the fish that was caught because they were so scared that it contained toxic substances. And then we also understood that even if the fishing communities actually get the mga shells, shellfish to actually eat, so that they can sell the fish. They don't eat the fish that they actually catch, but they sell them and then they eat the shellfish. But then they were not able to do that as well. So there were also, of course, environmental damage to the coral reefs, seagrass and mangroves, and etc. Now, so why is this important? It's important because when we talk about oil spill, it's always the environmental impact that is being highlighted, but not the humanitarian impact. When we went to the communities, many of them are actually saying, for the past 2 weeks, we didn't have anything to eat anymore. So even like a pack of noodles will be shared for the entire family so that they can eat at least once a day. And then before that, if you can remember, there was also El Nino. And because of the warming of the seas, they were not able also to catch as much fish as they can. So they were trying to make ends meet by looking for other informal livelihood, like, I don't know, being a barangay tanod. What's the English of barangay tanod, Arvin? Barangay police. Barangay police, and they have around 1,200 pesos per month, and that will be their own income for the family. So CARES and Partners response, this response was actually in partnership with Action Against Hunger and PKKK, or Pambansang Koalisyon ng Kababaihan. Next please. So during the alert note development, so what was done? I just wanted to highlight this, that during the alert note development, of course, the usual, we facilitated meetings with START Network members, and thank you for those who have actually supported the alert, because everybody was already engaged in the Karina response. And then we engaged local organizations. For example, our local partner, PKKK, has been in one of the areas in Bulacan for 10 years, and they were able to develop this engagement or relationship already with the LGUs. And they also have kind of established GBV, gender-based violence groups and things like that. They already knew about safeguarding, so we didn't have to work that much. Of course, the LGUs, and then the Philippine Coast Guard. And then I would like to highlight the engagement with Forewarn, through Forewarn. So we engage with the UP Marine Science Institute, who who actually advise us on kind of the way to go, what kind of response should we do, what is the trajectory of the spill, what's going to be the environmental risks, etc. So it greatly informed the alert note as well. So Alert 852 was finally activated for 200,000 GBP, although we asked for 300,000. And then it was for Bulacan, Bataan, Cavite, and Metro Manila. But then, because it's such a small amount of money, we decided that we will go for Bulacan and Bataan, mainly because Cavite and Metro Manila, they already had some access to quick response funds, for instance, and others. Next, please. So what did we do? Why? We only did 2 activities. First is the multi-purpose cash assistance, and the other one is risk RCC, risk communication and community engagement. So why multi-purpose cash assistance? I think many of my colleagues have already kind of discussed why it's important. It's about dignity. It's about the right to choose, and the right to actually decide what you need. And so each household, so we assisted 1,300 households, although from the report I just realized today that actually AAH, thank you very much, has, instead of I think you've given 104 more. You supported 104 more families. So that's around 1,405. 5 households. 5 pala. Ganon. And so, of course, this was given primarily to fisher folk and fish vendors. So each household received a one-time transfer of 6,977 pesos. This was calculated to meet 40% of their minimum expenditure basket. And of course, we made sure that we did some market assessments to ensure that there was no disruption in the availability of goods in the market. And of course, the services, making financial services, making MPCA the most efficient modality. And this was actually recommended as well by the allocation committee during the allocation committee meeting. So the transfer value of 6,977 is aligned with the National Cash Working Group recommendations and considered food security, wash, and one-off expenses like health and livelihood needs, of course in alignment also with the sphere standards. So 50% of the transfer value covered 35% of food needs for 30 days, ensuring that households meet their, sphere standards in nutrition, 2,100 kilocalories per person per day. Right, Glenn? Yeah. So, and the remainder addressed wash, energy, because they needed to pay power bills, transportation, and other immediate needs. One of the fisher women from Bulacan said that the cash assistance actually allowed her to buy medicine for her child and still have enough food for the family for 1 month. So we also made sure, and I'm talking about logistics, we also made sure that we have existing agreements with financial service providers. In this case, we have a framework agreement with Palawan. And then, and thankfully this was available in the areas where we were at in Bulacan and Bataan. So AAH used Palawan, PKKK as well, and CARE. So we had pre-negotiated terms to ensure minimal delays in fund transfers. And so we negotiated also a transaction cost of 50 pesos per transfer and included 200 pesos to cover beneficiaries' transportation costs to the nearest payout location. It was quite interesting because when we asked them, so do you want GCash instead of Palawan? Because GCash seems to be more easy, more convenient. But they said, no. We wanted to go to Palawan because for us it's more secure. And I didn't understand what they were talking about. They said it's more secure even if you have to go, because for GCash, they said there's a lot of scam in GCash. Yeah. So they wanted Palawan instead. Next, please. Next activity was RCCE. So over 6,000 individuals participated in risk communication sessions that focus on health risk from oil spill and safeguarding against abuse. So we went to 13 communities and we conducted, of course, this risk orientation, safeguarding, PSCA, protection from sexual exploitation and abuse, as well as child protection. So these not only informed communities about their rights, but created safer environment for women and children. And what I wanted to highlight as well, that for the RCCE, we actually worked with the BHWs and the RHUs, so there were some nurses who actually did, I think, this thing, it's not very clear. She was actually from the rural health unit, was giving the risk orientation, health risk orientation. And number 3, although this is not really part of the activities, but this is mainstreaming, really wanted to highlight promoting gender equality and empowerment, and of course safeguarding. I think someone earlier in the morning said that women became active decision makers in their households. So this was also the case because there were the cash assistance actually encouraged joint decision making, fostering equality or equitable access and resources. So one of the mothers there was saying that the cash assistance allowed them to decide together, so the husband and wife to decide together on what was best for the family. So they said that this wasn't the case before, because if it was only the husband who was making the money, it's mostly the husband who will also say, okay, you know, this one is for what, and even if they make, they give their salaries or their income to the wives. But this one, it was, many of them during the PDM said that it was because of the orientations on gender equality. So, yeah. All right, so there you go. Key insights and learnings. I hope nobody's going to kick me out. Anong oras na? Surprising discoveries. What are the surprising discoveries? So when we did the alert note for the oil spill, we didn't exactly know, 5 minutes left, we didn't exactly know the impact, you know, the severity of the situation. And because each incident compounded the environmental damage and humanitarian impact. For example, the oil spill not only contaminated vital fishing grounds, but also disrupted ecosystems and also disrupted the fishing in the community. So these were overlapping crises that demanded real-time adjustments. When we talked to the LGU, they had different needs. When we spoke with MSI, when we spoke with the Philippine Coast Guard, so there were a lot of information that was coming as we were actually implementing. So we needed to be more agile in our approach. And then community networks, such as the mother leaders of Hagonoy, Bulacan, my gosh, they are a force to be reckoned with. The mother leaders, they are the decision makers of the barangay. Actually, they are like BHWs, so barangay health workers, but they are more like, we kind of ask them to support us in identification of vulnerable individuals, as well as validation. So. And they kept the peace and safety and security of the community. And, and then, of course, because our partner PKKK was already there for 10 years, the community were more accepting of gender transformative actions in our implementation. So challenges faced, of course, logistical barriers, because as I said, many of the barangays were not reachable because of rough sea crossing, and some of the roads were still damaged as well because of Typhoon Karina. So transportation of our staff, because we were not actually transporting any essential supplies, but our staff and partners need to go there. So it took us some time, but there was also a strong collaboration and partnership with the local government unit, so that was managed. And this one, I hope that there are some scientists here. I know that there are people from the academe. Limited local expertise in chemical hazard management affected our response efficiency, because the oil spill introduced unique environmental and health risk. And that many local responders, like us, had limited experiences in handling. So managing chemical hazards, such as also determining the safety of water sources and mitigating long-term ecosystem damage, required specialized knowledge and equipment. So without immediate expertise or tools for containment and decontamination, the response expected some delays as well. Yeah. And then, of course, well, insufficient funding, but we all know that. Best practices are good practices. So I think I've already discussed about this. Leverage community networks like the barangay health committees and the mother leaders of Hagonoy, Bulacan. We collaborated with the LGUs, Philippine Coast Guard, local organizations, coordination with Forewarn, and probably as a recommendation, we really wanted to see more of a partnership between, through Forewarn, partnership between the local communities and the academe and the scientists. So there will be, some cross-learning, because there are also some indigenous knowledge that are there. The people know when seas would recover from an oil spill, for instance, or they would know that the toxins are actually coming because of the smell and where the fish is going, migrating, and the behavior of the fish, something like that. And of course, integrated safeguarding. I know we all integrate safeguarding, but really intentional and measuring and really looking into safeguarding and gender equality measures in all phases of the response. And yeah, adapted response plans using early warning systems and real-time insights. Anything else? So just stories from the PDM report. I will not read all of them, but most of them were really happy. I think 96% of them were really happy. I just wanted to also highlight that about transparency in our vulnerability scoring or beneficiary or participant selection. They said that it was clear why they were chosen, and they're thankful for that transparency. So, next please. Ayan. Okay, I'm just going to go through them very quickly, no problem. Build anticipatory and adaptive capacity. So I've already discussed about partnership between academe, scientists, and the communities. Also conduct community-based simulation drills to enhance preparedness for oil spill. I don't think that we have that as well. Next, please, expand partnerships and build technical capacity of local actors. I know that this is just a secondary hazard, but it has compounding effects on the communities, and we are not ready as local actors to respond to this. Promote collaboration and coordination, we all know that. But at the last bullet, facilitate data sharing and ongoing dialogue. Yeah. Number 3, advocate for flexible and scalable funding. I know that START Network and START Fund and START Ready, it's scalable and flexible, but we need more resources. So we need to advocate even beyond START Fund, or to ask the donors to give more money to START Network, and ensure funding models address both immediate needs and long-term recovery plans. Last but not the least, deepen gender transformative programming. And invest in long-term solutions. So collaborate with environmental organizations to rehabilitate affected ecosystem. Kasi with the START Fund, it's only 45 days, actually, and then sometimes we just leave when we have already given our support. We need to support them further beyond that. So this was done in partnership with CARE, Action Against Hunger, and PKKK. Thank you very much.
Thank you very much, Raisa. So, who is the courageous soul who would want to shoot the first question? These two ladies can be intimidating, you know. Okay, so, okay, Dennis, please.
Okay. I won't introduce myself anymore. So first, this is one question for both. So of course, the first one is on health, focusing on health issue. I believe there's, if I recall it right, about a 2 billion program for digitalization for DOH including disease prevention and control, data analytics, data gathering. Do you think you can, based on your recommendation, isn't it high time to penetrate that part? That's the 2024 budget. Same question for Frida regarding the nature of your work in relation to, especially to, this was mentioned by Nina already, the DOH social protection, including the Walang Gutom program. The Walang Gutom program is 1.89 billion for 2024. Do you believe that through the efforts perhaps of the entire group, it's a very strategic move to try to encourage both national agencies to be a source of scaling up financing?
Yeah, I think about the fund that you were talking about for the digitalization of the disease surveillance platform. Actually, it is so. It hasn't yet been rolled out to most barangays, which is, we also actually were expecting to do much more and to chip in much more with the funding that we had, but we found that they're still planning the rollout. So it was pilot tested in some schools and with some barangay health workers, but they're right now pilot testing it. So it hasn't yet been rolled out, which was a big challenge, but I think it's the way forward. And I think advocating for that, which is also what we did with all the barangays and the municipalities, was to advocate that that is rolled out the fastest, soonest possible. And especially in a moment like this year, it would have been super valuable to have something like that. So yes, absolutely right on that.
And just to add, I think it's about time as well that we intentionally engage private sector, because they are the ones who are very, very interested in digitalization, even private foundations. So CARE, we have been talking to a private foundation who's really interested in supporting this DOH project. And they were saying, you know, so how can we support? And then we have already kind of had this discussion with DOH. So I think it's not just, you know, the government and us and the academe, but really the private sector can push this thing forward because, well, not only do they have money to pilot, even just pilot, but they also have the expertise, you know, on how to, I mean, you know, innovations and things like that. So yeah, and the answer is, I think it's about time. I think we're already late, actually. And then the other one was, you know.
Okay, thank you. Okay, I see your hand here.
Good afternoon. I'm Doris Melgar from the province of Oriental Mindoro. You heard who is the expert here in the issue of oil spill. I know our governor, Bons Dolor, was invited by the LGU of Bataan to help them resolve the issue. Ms. Raisa, I have not heard about the indemnification of all those fisher folks or all the Maninda market vendors affected by the oil spill. What is the obligation of the company, oil company, on this regard? Thank you.
Yeah, thank you very much. I think they were trying to keep this news thing at wraps, you know. I mean, that's why there's not a lot of news that went out. I think most of the news was just about, okay, you know, this happened. But then I remember even the news of the 2 subsequent maritime incidents was really not highlighted. So, and because we know that this is related also to a big, how do you call it, a company, right? That is working, developing the, what do you call this? The airport there. Okay, let's just say it at that. So there has not been quite a lot of a focus on that. Although we did have Start Network donors who came and visited the communities. And one of the, I don't know if Noel is still here, FCDO actually reached out to work with the corporation that was sort of implicated in these incidents to see how they can support the communities. But it's not out there. It's not being made public. There's a lot of really private advocacies that are happening. Yeah, unfortunately. But can I ask to the audience? Has it happened in Mindoro?
In Mindoro, the provincial is very vocal on the issue of paying back the community, on all the affected. And I know the insurance company is right now paying, and konti na lang ang hindi pa nababayaran. Even the ground zero, they're paying.
Should learn from that.
Yeah, I think that is an interesting thing, because there's a lot of sensitivities when it comes to the environmental hazard. At the same time, how this private, the private institutions and companies would cover this, and how the political dynamics as well in terms of addressing the issues of indemnification. So I think we can learn from the Mindoro experience and probably look at that in the context of addressing secondary hazards as well, if we get to experience again oil spill. So again, there's another challenge here. I think, how do we move forward in terms of coming up with protocols and guidelines for something like this? Because we haven't really gotten into a lot of the protocols and guidelines for environmental hazards in general and oil spill in particular. So I guess way forward for a lot of us, we're very focused on addressing typhoons, etc. But a lot of these things will be happening and will be challenging in the future. I would pass to Bong because it's, yeah.
I think the two initiatives are modeled already, no? About data management, you mentioned, and even this morning, na-highlight din yon. Second, accountability. What we responded is limited in terms of scope, no? Did it encourage the LGUs to address uncovered families, no? And lastly, I think, what policy proposals do you think? Do you have in mind policy proposals that really will address these gaps, no, in terms of addressing secondary hazards and others?
I think with data management, it's an ongoing challenge. I don't think we are going to be able to resolve it completely right now. Even with the DOH right now, we are working on planning processes. So within planning processes, data is extremely important and critical. And I find that it's an ongoing process, because there are challenges, new challenges that come up as they, it takes time for, I think, government bureaucracies to find solutions, and solutions are found to problems that continue to evolve. And while you solve the previous problem, you have a new problem that, needs to be addressed. So data management, as I have seen, but my colleagues on the ground who work specifically on health would be able to give a bit more on that in terms of the challenges they really face in data management. But we've had some problems in some barangays, it's not there. Like it also depends a lot on the leadership of the department, of the CHD or the rural health unit or the health station, whether they are engaged or not with the community. So a lot of it is also personality driven, unfortunately, because then that becomes subjective. But where we found leaders engaged within the barangays, we found data managed better and data available in terms of families with health concerns, families that have members that have persons with disabilities, members with disabilities, or for instance, incidents of waterborne disease, illnesses. So we found a lot of it personality-led, but I think structured data management continues to be a challenge, and I think it's an ongoing kind of challenge that is being addressed. I wouldn't say I'm optimistic that that there is a awareness and that there is a willingness, but it's taking time. Then concerning accountability, actually when we were selecting beneficiaries, because we couldn't give to everyone and funds were limited, the process of transparent selection and identification and a pre-identification, especially in some of the barangays, helped a lot. And this consultation, which was slightly wider, gave us a buy-in from everyone, and that mitigated, I would say even prevented completely any kind of tensions that could have emerged, because we are looking at some of the neighborhoods where we went, we're looking at a larger section of the community which would have required this assistance. But we had limitations, and so we really went to the most vulnerable, or people at risk of high vulnerabilities. Then the third question, I didn't exactly get it. That's a good question. Do you have any policy recommendations? But that's a good question, and I don't know if I'm the right person to come into these sensitivities here. I'll let Reza answer that.
I'm immune because of my nationality. Okay, no. All right, so thank you for that. I just wanted to start with accountability, and then later policy recommendations. When we were in Hagonoy, Bulacan, you know that these barangays are actually, you can just imagine that they're going to disappear in a few years, right? They're going to be like underwater in a few years. But when you talk to the communities there, they said, nasanay na kami. We are so used to this. And it seemed like because they are so used to this, they are just dependent on external help, external support when there's a disaster. They don't even anymore, let's say, call out their leaders, for example, or tell their leaders, we need this and we need that. Yes, the SWD is giving the food packs, but that will only last them 2 to 3 days, 5 days if they only eat once a day, right? Yeah. So that's it. And then there is I forgot the name of this program, but they give like 10,000 pesos per family. A starts with the letter A, but anyway, so but as per reports from the communities, they receive this a year after the disaster, or they're even lucky if they receive this months after the disaster. So they have already resorted to negative coping mechanisms, right? They are already drowning in debt. So that is the situation, unfortunately. And I think it is two ways, for the government to be made accountable. The people also need to know what their rights are, and the services that the government should be giving, even before, during, and after disaster, so that they can ask for it. And I think this is the situation, because they're already in a very, very precarious situation. They just kind of depend on any external help. Now, about policy recommendations, I think it's really about, I'm just going to talk about oil spill, including secondary hazards into disaster preparedness plans, because we're always talking about typhoons, floods, earthquakes, etc. But secondary hazards are probably not there for all the LGUs. So, yeah.
I think I can add. I mean, in terms of policy, I think that the kind of work we do as a whole kind of network of members is this work that we do itself actually provides that evidence for advocacy. And we are kind of modeling the disaster risk financing and the anticipatory action that can be supported and that can have allocation of funding, because a lot of the funding comes in for response but rarely comes in, de facto rarely is utilized for anticipatory action, because either it's too late or there's not enough awareness or not plans in place, contingency plans and otherwise. So I think if we can use this platform, Start Ready, to compile the evidences that we have and use that for advocacy, for policy implementation. I wouldn't say that there aren't policies and mechanisms. They are existing, and in fact, I see it in many different sectors in the country, which is amazing for me that there are mechanisms and policies. It's just that they are not implemented, or many are not aware of it, and the linkages along the tiers of governance doesn't happen. But I think we could provide that kind of platform for advocacy and take this message across to policymakers, and actually also at the local, what I see at the local barangay level, because I see a lot of devolution of power, and I think there is where we can also make things happen. So for me, I have a lot of hope in the country, in the people of this country that I have met and are very, very aware of the situation, that policy advocacy is something that has sufficient evidence and that we can. The thing is that we don't have anyone to kind of bring us together and make that happen. But we have Yovi and Arvind here and the team that could actually, together with us, do this kind of a policy advocacy forum where we can call in the policymakers and share with them the evidence that we have, right? Thanks.
Yeah, thank you, Vrinda. I think that's a good segue to close. But Bong is raising his hands.
Yes, because Nina this morning mentioned about funding windows that I think not maximized. Maybe some of these models can be tied up, and how do we source that window, funding window? And I think that's part of the policy. And maybe Start Network can lead.
Okay. So I guess that wraps up the last session for this afternoon. Please give Vrinda and Reza here a hand of thank you very much, and I hope secondary hazards are given more importance versus the primary hazard. Thank you and good afternoon.